So the infectiousness of a Delta is roughly twice. And it's by far the dominant strain. It's up to, I think, 90% in New Jersey at this point, which is, that's pretty much taken over. And that happened very quickly. If you go back a few months, it's pretty astonishing how quickly the Delta variant, when it first sort of showed up, I think in March, maybe misspeaking there, but around that time frame, it was really, really small. It's just one of those that we kind of tracked, and it's completely taken over. Latest data being close to 90% of the new cases. It's worth noting that we don't actually know when a new case comes in whether it's Delta. So we can't test for that at Jersey City. Hospitals don't test for it. The samples get sent to the New Jersey Department of Health, and they do the testing. They don't actually tell us whether that particular case was Delta or not. What they do is they aggregate the test samples from across the state, and they just do it sort of for epidemiological purposes. They say, okay, we got 200 samples. 198 of those were Delta. Here's the numbers across the state. They don't actually tell each individual hospital, yours was Delta, yours wasn't, yours was Lambda. So we don't actually know individually what our cases look like. In terms of Lambda, it's a much smaller percentage right now. The fear there is, again, does it evade the vaccine response? And I think more to come on that, right? The fear would be that it becomes the next strain. If Delta kind of runs its course, it has its peak and falls off, does some new variant become the next dominant strain? It's all about survival of the fittest. It's sort of rapid cycle Darwinism. The viruses that mutate and change, if they're more successful than their predecessors, then that becomes the dominant strain. It's more likely to spread, it's more likely to remain infectious, whatever it may be. Again, the way that they change is they alter just a little bit of their surface proteins, their spike protein, or the way they mask it, just something that's a little bit different that happens to make it more successful. And that successful variant then spreads, and that spreads, and that spreads, and then all of a sudden you've got a new foothold for a new variant. And personally, that's my biggest fear. As someone who now considers myself very protected against current versions of this virus, a new version, a new variant could change that all in a heartbeat. And so the longer this goes on, the more that becomes an inevitability, right? The longer that there are pools for this to replicate and spread, there will continue to be variants. Most of them are going to be duds, right? There's a mutation, it's actually less successful, it dies off. There's another mutation, less successful, it dies off. But if there's a big enough pool of replication, sooner or later, one of those variants is going to be more successful, and it's going to start to expand its foothold. So if we let this go long enough, it's inevitable that one of them will be more successful than the Delta. It'll take over as the dominant strain. We may or may not be able to combat it, and we're going to find ourselves kind of back to square one again. I don't mean to be doom and gloom. All right, that's worst case scenario. The good news is that if that happens, and I certainly hope it doesn't, and it doesn't need to. Again, that's sort of the part that frustrates public health people. This doesn't need to happen, right? If enough people get vaccinated, the US has an embarrassment of riches when it comes to access to vaccines. Everybody who wants a vaccine can get one tomorrow. And if every single one of those people who could get a vaccine went out and got it tomorrow, coronavirus would be over in the US in 2 weeks, right? But that's not happening. We still have large groups of people who are not vaccinated. And so if we allow that replication to continue, we're just going to end up with new variants and have to combat them in whatever way we can. So the mRNA vaccines can be tweaked. That's the good news, right? If say the Lambda variant becomes dominant, it's less effective, the vaccines that we have currently. The mRNA technique would allow Moderna and Pfizer to sort of modify the instructions that the mRNA gives our cells and theoretically produce a more effective antibody. But that's a game of cat and mouse. So we don't really want to be in that, right? We'll be sort of chasing whatever variant is dominant out there. And we can do that, but we're far better off getting ahead of it. If we can get enough people vaccinated against what's out there now, then those variants don't arise. If we allow those variants to arise and we get behind again, then we're going to have to anticipate and try to all over again vaccinate people against what's out there before we can get ahead of it. So, I mean, we're in a crucial window, and the longer we allow that window to sort of draw out, the less likely we are that this particular vaccine that we have access to today is going to be what ends it. So.